I appreciate the opportunity to be here, and I sincerely appreciate the opportunity to be here. It's an honor for me to talk with you a little bit about the one-year anniversary of the PPACA, the Patient Protection and Affordable Care Act. We're going to talk a little bit also about what occurs between the one-year anniversary and 2014. Then we're going to talk about 2014, which is a big game changer. And then we'll also talk a little bit about health care cost in general, okay? What's driving health care cost, which is the reason why we're here today talking about PPACA. Well, the legislation was passed a year ago. It was signed, and 1,200 times in the bill it says the Secretary shall. What does that mean? That means that the Secretary shall promulgate the rules and the benefits associated with the framework of what Congress passed. So when you remember Speaker Pelosi saying, just pass the bill and we'll figure out what we have, she was correct. That's the way they do it in Washington. They pass the framework of the bill, and then they begin to plug in the actual regulations associated with the bill. So what happened in the first year? Well, the first year, we noticed the first provision was to allow individuals up to age 26 to reattach themselves to their family policy. There was a gap. Typically, individuals who were 24 years of age, their eligibility opted off the insurance plan, or you graduated from college, your coverage under your group health insurance plan was no longer effective. Well, this piece of legislation allowed you to go back and reconnect with your parents' health insurance plan up to age 26. So it extended coverage for that gap. The second thing it did, and this is pretty important, is that it took the under 19-year-old category and it created a guarantee issue environment. This is the very first time that the industry has been forced with accepting people without evidence of insurability. Now, you may have heard that the Patient Protection and Affordable Care Act had some provisions in it that was going to create some uncertainty in the insurance markets. Well, that's it. Anytime an insurance company can't evaluate the risk and apply a rate that's appropriate to that risk, it creates a tremendous amount of uncertainty. So what happened in Louisiana? There's only one company left in the under age 19 guarantee issue market, and that's Blue Cross. Our mission is to provide health guidance and access to quality, affordable health care. It's part of our mission. That's all we do. We operate right here in the state of Louisiana. So rather than leaving an entire market with nowhere to go, we are the last insurer standing to offer guarantee issue. Now, what that means is you've been diagnosed, you need a kidney transplant, you stop by the Blue Cross office, you pick up your insurance policy before you go to the hospital. Keep that in mind, guarantee issue, because we're going to talk in 2014 how the extension of that particular piece of legislation is going to severely impact and disrupt the insurance market. What's going to go on between now and 2014? Well, there's a simple little provision out there called medical loss ratio requirements, MLR. That is the ratio of claims to administrative expenses. Now, the government is saying for insurers doing business, health insurance, that depending upon the block and the line of business, that your administrative expenses has to be within a certain level or you owe a refund back to the customers because you've taken more out of the premium dollar to pay for administrative expenses over claims. And that number is 80% for small business, 85% for large business. So that is the Patient Protection and Affordable Care Act's attempt to regulate profits within the insurance industry. All right? And that provision is going to be enacted next year, and insurance companies are beginning to question what's going to be cut in order for them to make those provisions. Our insurance commissioner filed a waiver with Secretary Sebelius asking her for an extension of that particular provision and to waive the need for us to meet those medical loss ratio requirements as an industry. Because one of the first things that the industry did is, well, maybe we'll adjust commissions out. We'll take out broker commissions, insurance agents' commissions. And that created a flurry of controversy as the industry began to try to meet those medical loss ratio requirements. I hope I made that understandable for you. Okay, so let's talk about 2014, because that's the big game changer. That's when a lot of the provisions of the Patient Protection Act come into play. And here is where most of the controversy arises. As we try to expand coverage to those 50 million Americans who heretofore have not had insurance coverage, the first way that the PPACA legislation attempted to do that was to expand Medicaid. Right now, Medicaid, 105% of federal poverty level, you get Medicaid. The expansion now is to 133% of federal poverty level. Now that's substantial, and you're hearing governors complain about how difficult it's going to be to manage budgets when they can hardly manage the Medicaid population they have today, and now they're going to expand it to 133%. It is expected in the state of Louisiana to add another 600,000 Louisianians to the Medicaid rolls. From 1.1, 1.2 Medicaid recipients today, in 2014, with 133% of federal poverty level, we're going to add another 600,000 people to Medicaid. That's significant. That's a huge responsibility that the government has to figure out how to manage that population. Now, here's the second big game changer. From 133% to 400% of federal poverty level. That's a family of four making $88,000 a year. In that population, 80% of Louisianians reside from poverty to 400% of poverty. 133% to 400% of federal poverty level, you'll receive a premium voucher, premium assistance from the government. So now for the first time, the government's going to say, if you meet certain requirements, one is federal poverty level, and the second is enroll in these exchanges that are going to be created, we're going to offer you some premium assistance. So I ask you, as we're struggling with budgets today as we know it, based upon the current entitlement programs that exist today, from Medicaid to Medicare to Social Security, this is one of the largest expansions of those programs in the history of the United States. And the question in the minds of the regulators and in the general public's mind, closer to 214 we get, how much of that can we afford? How much of the expansion to 400% can we afford? So I think you'll see, as we wrestle with budgets in Washington, moving from 400% maybe to 300%, maybe taking federal poverty level for Medicaid from 133% down to 120%. It's going to be a lot of negotiations back and forth among Congress to try to determine where that sweet spot is. What can we afford? Which brings us to an interesting point. A lot of those things are going to be occurring, and a lot of those things will require employers to either pay fines if they abandon their group health insurance plan or continue their group health insurance plan under certain conditions. We're creating an exchange. The legislation calls for an exchange. An exchange is a place where people go to shop for their health insurance. You can only get your premium assistance if you go to that exchange. So the exchange is going to be very popular, and it's going to be a place that's somewhat controlled and regulated by the government. That's where we talk about the government getting involved in the private markets. So many people will be going to the exchange because, keep in mind, I said 80% of Louisianians fall within 400% of federal poverty level, which means if you want premium assistance, you have to go to the exchange to get it. So they'll be rushing to the exchange. Employers will be dropping their group health insurance plan, many of which, in order to enable people to go to the exchange, and then they'll end up having to pay some fines or some taxes based upon abandoning that plan. So the government hopes to recover some of that money through some type of fine or tax basis. What got us in this predicament where we are today? It's the rising cost. It's the rising cost. Our insurance premiums back when my father was teaching me how to start the lawnmower were 4% of the GDP. Today it's 17% moving to 20%. We can't afford the trajectory. Insurance as we know it today, the healthcare delivery model as we know it today, is based upon these two primary factors. Unit cost, how much does it cost for that drug? How much does it cost every time I go to the doctor, every time I go into the hospital, every time I need a piece of durable medical equipment? How much does that cost? That's a unit price. And the other is utilization. How many times do I go? And as Americans, we use the system a bunch. We're comfortable with our healthcare system. We access the system often because we have direct access to any provider based upon the current condition that we have, or the condition that we think we have, or the condition that the TV said, if you're looking for a prescription drug to handle that, ask your doctor if this is right for you. We have direct access into the physician or the delivery system. So the cost, the unit cost, times the utilization equals a trend. What we have to do is reverse that. We have to put the incentives a little differently, because you can't continue to just churn and churn and churn. There has to be a balance in the way that we compensate for healthcare costs. Let me share a little story. It's hot off the press, and I make it available to anybody that wants it, but it's from the Office of the President. It's a report. This report gives me a lot of hope and a lot of pride when I tell you that in this report, it lists the amount by state that insurance premiums have risen for family insurance. All of you can think about your insurance premiums, how much they've grown over the past 10 years. In this report, those increases range anywhere from 145% in Alaska to 88% in Michigan. You know where Louisiana is? 89%. We're number one, plus or minus an error factor. For all practical purposes, insurance premiums for families have risen less in Louisiana than any other state in the nation. Why is that? Because we still are operating that old archaic fee-for-service system that I talked to you about. Well, it's about eating right and moving more. Anybody heard about the two-step program? It's about our efforts to start talking to kids at a very early age about the importance of nutrition and exercise. It's about some of the disease management programs we put in place for our diabetics. It's about us getting together with our provider partners and talking about just how much of an increase do you need. I think some of you may recall a little bit of a dispute we had with Our Lady of the Lake recently. But that's what it's all about. It's about holding down our unit cost. It's about attempting to work with and make a difference in the way that we behave as consumers of healthcare services. So there are a lot of changes on the horizon as we attempt to continue to focus on changing behavior, helping individuals understand how healthcare reform starts at home. You can play a big part in holding down healthcare costs by being more accountable for your own personal health, to the changes in the delivery model away from the old archaic fee-for-service system. There's a lot that's going to change over the course of the next few years. With the help of the press, it's critical that we join together in an attempt to try to make sense of it all. That the points that I bring to your attention are points that we can easily explain to the reader, because there's so much uncertainty in the market today. And our objective is to make sure that we serve as an educational conduit to help the press, help the media, help our customers understand the complexities of all the changes that will occur. So I want to thank the press in advance for allowing me the opportunity to be here, and I sincerely thank you for that. And also I'll thank you in advance because I know that you're going to play a key role as a partner of ours to help us take some of the complexities out of the system and communicate that with ease to the general public. So I will stand at this point and be happy to answer any questions that you may have. It's the one-year anniversary of the PPACA, the Patient Protection and Affordable Care Act. So we're here today to talk a little bit about some of the changes in the industry which have occurred as a result of PPACA. Then we're going to touch a little bit on what's going to happen over the course of the next year or two. Then we'll focus a little bit on 2014 and beyond.
For people that are not familiar with the details of the new health care bill, tell us exactly what's going to happen.
Well, the objective of the health care bill was to expand coverage to roughly 50 million additional Americans who are uninsured. As a result of that, there are multiple ways to go about achieving that, from an expansion of Medicaid to a system where people can enroll on an exchange and receive premium assistance from the government. So there are multiple ways in 2014 that people will be able to engage in health insurance coverage who heretofore have been uninsured.
Now, is all of this set in stone, or is there a possibility of changes between now and 2014?
Absolutely, a number of changes which will occur. Over 1,200 times in the legislation, it says the Secretary shall, which means rules are being promulgated, rules are being discussed, negotiated between the White House, the industry, and all special interest groups. So there will be a number of changes that occur between now and 2014.
What are the most fundamental changes with the new health care bill as it stands right now?
Well, we allowed individuals up to age 26 to attach themselves back on the group health insurance plan. So if by chance they graduated or they aged off the plan at age 23, 24, now they had an option to get back into their group health insurance plan under their parents' plan. In the under 19 category, for instance, there's a guarantee issue provision, which entitles an individual, regardless of their health condition, to come secure access of an insurance policy without regard to any waiting period or pre-existing conditions. So there are pretty significant changes that occurred in 2010.
And what kind of an impact will this have on health care premiums that people pay?
There's going to be some significant impact on premiums, most of which will come in 2014. In 2014, when the exchanges are introduced, most of the provisions for the PPACA legislation will go into effect, and we'll talk a little bit about what some of those changes will be.
What's the best advice that you have for people right now that might be concerned about health care coverage?
Well, there's an informational source. If they'll go to our website, www.bcbsla, click on healthcare reform, and there will be an opportunity to answer a number of questions that people may have about healthcare reform.
What are some simple things that people can do right now to be able to lower their risk and maybe lower their premiums?
Yeah, well, I'm always an advocate of accountability, consumerism. I think healthcare reform starts at home. So I have been preaching for years the need for us to understand our numbers, understand your blood pressure, your cholesterol, understand your glucose levels, understand those drivers that can influence your own personal health, and let's do our best to try to avoid claims with good wellness and behavior programs rather than managing a claim after the condition has occurred.